Oh, this is duloxetine.
Danielle Rose can measure her life
Ibuprofen, just the regular 8, some pains 800.
in bottles.
That's it. My life in bottles. Is this the craziest thing you've ever seen?
Step back.
A far cry from just a few years ago when Danielle was training to compete in a fitness competition.
I was so strong.
Now, she struggles to walk downstairs.
I'm just not the same person. Right now, I'm stuck like this. This is my life. I've lost everything.
She lost her job at the Wynn Encore after 20 years and lost her health insurance.
I've had to get private insurance, disability. I'm in constant pain all the time.
It began in the spring of 2021 when debilitating migraines, vision disturbances, and inability to sleep led her to seek neurological care.
I get the MRI, and not even 24 hours later, the primary doctor is calling me on the phone saying, "We have an issue. You have lesions on the brain."
In February 2022, she finally learned exactly what it was.
You have something called a pineal tumor in your brain. It was shocking to hear.
According to the Cleveland Clinic, pineal tumors aren't always cancer, but they still cause problems as they grow. Surgical removal is difficult due to its location in the middle of your brain, and because of that, it's not a common treatment. But it's the treatment Danielle sought.
I said, I want the damn thing out of my head. I want it out. There was no question.
You get a little spread of tumor into the surrounding brain.
Neurosurgeon Dr. John Anson of the Spine and Brain Institute performed the procedure on April 12, 2022 at Southern Hills Hospital, where he's currently chief of staff. In Danielle's surgical report, Anson wrote, "I carefully dissected it free, and we continued until no further identifiable tumor appeared to be left."
It was a 4-hour-long surgery. I have titanium mesh and screws that were put in my head.
Danielle later learned it was a benign grade 1 tumor, but as time passed and she wasn't improving, she returned to Dr. Anson.
I told him, I'm still not feeling any better. I'm not sleeping well. My headaches are bad. Things haven't changed. He said it takes time. You just got to give it time.
3 months after surgery, this MRI showed a 13-millimeter pineal lesion, only slightly smaller than the 15-millimeter pre-surgery mass, with a similar effect on the brain. At first, she thought the tumor had come back, but in October 2023, when she sought care from a team of specialists at USC's Keck School of Medicine, a neurologist there delivered shocking news.
The tumor is still in your brain. It was not removed.
According to medical records from Keck, it was only biopsied, something Danielle says Dr. Anson never told her.
Hi.
More than a year after her surgery, she met with Dr. Anson again, this time bringing a family member and audio recording the visit on her cell phone.
MRI is stable.
That's fine. The little residuals there, but it's not changing. There's no obstruction.
So there's nothing at all anymore?
No, there is, but it's stable. A little bit of residual.
Okay, so there is. What do you mean? I thought it was removed completely.
We did not get thrown out.
No?
The scan showed the part that was anterior that was really stuck to the back of the brainstem.
Right.
Was a little too dangerous to remove.
As for her continued health issues,
I don't think it's the cause of really these other ongoing symptoms.
they ask him what percentage of the tumor is left.
30%, something like that.
Danielle's MRIs indicate more than 80% of the tumor remains in her brain. Anson tells them it was safer not to try to remove the entire tumor once they learned it was a benign grade 1. But remember, that's not what he wrote in the surgical report, and it's not what he billed Danielle's insurance for. Her records show Dr. Anson charged Health Plan of Nevada more than $30,000 for removing the tumor, a procedure HPN found he did not perform. In this letter from May of this year, following Danielle's complaint, the State Division of Insurance confirms medical records do not support the previous services billed by the provider. HPN required Anson to resubmit the claim with a corrected bill. The state also says it does appear that HPN may take further action against the provider, but that is confidential and will not be disclosed.
I wanted to leap out and go ballistic.
Danielle has not confronted Dr. Anson about the discrepancy between what he wrote in the surgical report and billed for versus what actually happened during surgery.
I stayed quiet because in the back of my mind I thought, okay, I need to get a lawyer.
But those efforts have failed. Multiple lawyers have told her although it seems she has a legitimate claim, the statute of limitations has run out. Aside from the State Insurance Division, other attempts at seeking accountability have fallen flat.
Filed a complaint with Southern Hills Hospital. Their response to me was, sorry for the miscommunication.
In November 2023, Southern Hills also apologized that her care did not meet her expectation. Then the hospital closed its investigation.
Nobody wants to take responsibility.
And so did the Nevada State Board of Medical Examiners, telling Danielle they still may address the issue, but those actions are not a matter of public record. We reached out to Dr. Anson for comment via phone, email, and text. More than a week passed, and we'd heard nothing until we told Southern Hills Hospital that he wasn't responding to us. And then he reached out, even agreeing to do an on-camera interview. We agreed to hold this story to accommodate his schedule, but 2 days before the interview was supposed to happen, Anson backed out. He did speak to me on the phone, however, saying what he wrote in his surgical report is what he thought happened at the time. He thought he'd gotten it all out and was surprised there was so much left. Even so, he says the bottom line is that the tumor was benign, so there would have been no reason to be more aggressive in such a sensitive area of the brain. He also believes he told Danielle all of that during her 3-month post-op visit, saying maybe it's on me that she didn't understand my explanation or did not remember it. I always make an effort to explain conditions to patients in a detailed and comprehensive manner, but sometimes confusion still remains. As for the insurance claiming he billed for a procedure he didn't perform, Anson blamed that on HPN's incorrect interpretation of billing codes, which he says his billing service is now working to correct.
You received a follow-up.
Though the state medical board did not take action in Danielle's case, Dr. Anson has been disciplined in the past. In these complaints from 2014, the board charged Anson with malpractice twice. In one case, a 10-year-old child became quadriplegic and later died after Anson nearly severed her spinal cord during surgery. Anson told 13 Investigates, "That was the most painful thing that's ever happened to me in my career." In both cases, the board allowed Anson to settle the malpractice charges by reimbursing their investigative costs, doing 20 hours of continuing medical education, and making a $3,500 contribution to a nonprofit medical organization of his choice. Anson was also sued by the patients' families. Both cases were settled out of court. As for Danielle,
I'm just going to continue to go to USC every 3 months to the headache specialist, do what they can to try to help me with these headaches, and just try to function on a daily basis and live my life.
Danielle's records from USC show she is not a candidate for another surgery or for radiation. She is continuing to fight for accountability, and the Nevada State Board of Medical Examiners is giving her complaint a second look. Southern Hills Hospital said it was unable to discuss individual patient care, but affirmed Dr. Anson's integrity, saying he's highly respected and upholds the highest standards of professionalism. Darcy Spears, 13 Investigates.